think my talk will follow nicely from Art's. I want to do a dive into who it is that's distrusting. When I talk about distrusting, I'm taking the notion of skepticism, which is the title of this panel, to include trust, distrust, and conspiracy theories, which are obviously part of distrusting, to look at who that is and why they're distrusting, particularly recently. Okay, so I begin with the notion, with the premise that I question about man being rational. So science prides itself in being rational. The whole point is we take evidence, we objectively analyze it, and then we come to conclusions that should be unassailable from anything but more evidence and more rational analysis. A few quotes. Descartes, the champion of human rationality, even pointed out that custom and example are often more important in formulating beliefs as opposed to knowledge than actual knowledge. Elliot Aronson, a social psychologist and one of the founders of the notion of cognitive dissonance, pointed out that man is not necessarily a rational animal, he's a rationalizing animal. And our rational capabilities are often harnessed more in the interests of rationalizing, of coming to an explanation that we want, than objectively analyzing data. And then a recent study looking at the evolutionary implications of rationality, again, concluded that as a species, we're really the rationalizing animal, not the rational animal. In line with that, conspiracy theories are as old as humanity, at least as old as humanity. They undoubtedly go back much further. I would wager that if we could ever find out what's going in the mind of a chimpanzee or a baboon, we would find conspiracy theories about other groups and about their leaders. We've seen them back to ancient Rome and even earlier, medieval England. The claims that the Black Death, the plague, came from Jews poisoning wells, burning witches in England and New England. These are just a few prominent examples. And then they've been observed across societies. Even hunter-gatherer societies, contemporary hunter-gatherer societies, have conspiracy theories and distrust of authority. An example, since we're talking about recent issues in skepticism, a lot of them relate to vaccines and the COVID vaccine. Vaccines have been the focus of conspiracy theories since there were vaccines. So unfortunately, vaccine hesitancy goes back to the first vaccines. If we look at this illustration, as I'm sure you know, Edward Jenner developed the first smallpox vaccine based on cowpox, a relatively benign version of the same virus from 1806, just 10 years after his vaccine was developed. Here's a political cartoon answering critics of vaccination who said, oh, it's going to lead to women having sex with bulls and producing half human, half animal offsprings. I'd say that's quite a conspiracy theory. Another one from the late 19th century showing a serpent threatening a wholesome mother and child with the evil of vaccination. And then another example, again on the cow theme, that vaccination was going to be a cow-like monster that was going to devour poor children. I don't know how many people believe this, but I think it reflects some of the sentiment of the time. And of course, today, we've got lots of conspiracy theories in terms of health-related theories. We've had fluoridation being dangerous, being a plot to poison our water. That goes back a few decades. Raw milk, which is still a notion widespread, a particular concern with avian flu, but the idea that it's somehow healthier, that the people who are pasteurizing our milk are taking the health out of it. I was surprised when I was doing some research to see the skepticism of sunscreen. And there are questions about some of the chemicals in it, but the claims are that sunscreen is more likely to give you skin cancer than the sun.
Ah, est-ce que je peux vous aider pour autre chose?
And this is AI with a new conspiracy theory.
We can carry on.
Okay, just as long as we keep the beast happy. Hydroxychloroquine and ivermectin for COVID, well, over the internet, and of course, good old vaccines, MMR and autism, which despite all the debunking, is still a very common theory. Andrew Wakefield makes hundreds of thousands of dollars a year going around the United States preaching this. And I suspect it always will be a focus of skepticism and some conspiracy theories. So what are the common themes here? That someone in a position of authority, could be a drug company, government, a political opponent, is trying to fool us for their benefit. They're suppressing the truth, that cures are actually easier than they're making out, that we don't have to use these fancy, expensive prescription drugs. Science is being used as a tool of public powerful interest, and the way to respond is politics. Support the candidates who share our skepticism. As Art pointed out, we've seen a spike with COVID, disinformation, a lot of it motivated by distrust and resistance to mitigation measures. People don't want to have to wear masks, stay at home, social distance, take the vaccine. And what I'm going to show is the partisan divide, which is not just a side effect, but is a driver of this. So I have a bunch of slides of graphs which parse this in more detail. First is just generally, by the way, I should say most of these come from either the Kaiser Family Foundation or the Pew Foundation. More than half of Americans believe that the government is exaggerating the number of deaths from COVID. And when I say government, this is a very US-centric presentation, so it means the US federal government. But you can see that for many of the others about the vaccine being more dangerous than the disease, that the disease is magnified, are supported by substantial minorities of the population. So the skepticism related to COVID is real. Belief in vaccine and disinformation has also risen, not just as you see with that red line, not just for COVID vaccines, but it's spilled over into all vaccines. And then that yellow line rising in the last year or so, that the vaccine is actually more dangerous than the disease. And we see this generalized into distrust of science in general. These are figures for the number of the members of the American United States who have a positive view of the effect of science on society. And you can see that trend starting for the start of the pandemic, coming down steadily, so that now it's only a little more than 50%. Art mentioned Anthony Fauci. He just released a book with his reminiscences of his whole career, but obviously a particular focus on COVID, and saying that he sees a crisis of trust as being the greatest threat to public health, not the public health emergencies, but the lack of trust in scientists to respond. Now, maybe he's overreacting given his position and his sensitivity to his partisan attacks, but he'd be in a position to really experience the virulence of a lot of the pushback against science. Where does this come from? And I have a few of these graphs on the partisan divide. And we all are aware of this. Again, these are US-centric figures, but here is confidence in science, which I showed in previous graphs was going down. And you can see how much more it's going down among Republicans than independents, and Democrats has been going up. How did we get here? So the lawn sign on the left is one I see a lot in my neighborhood. The long side, the one side on the right is a response to it. I don't see that in my neighborhood, but I imagine there are neighborhoods where you see a lot of that. The one on the left kind of is what started out, a whole set of beliefs and values, bragging about values, turning trust in science into a belief, into a moral point. And then the other side saying we believe all lives matter. Science is not political, being a reaction to those who believe that the government should be driven by science to mandate vaccines and masks and so forth. You see the importance of belief and publicizing your beliefs as sort of a badge of honor. So I showed the decline in trust in science, and we can see it here again starkly in partisan, going down much more steeply among Republicans than among Democrats, only slightly among Democrats, and more or less plummeting from 70% to 47% among Republicans. Again, trust in scientists, taking the general skepticism of science and personalizing it, turning it into skepticism of individuals, sort of an ad hominem approach, again, much more among one political party than the other. Generalizing it to the scientific community, to the individuals who are part of science, in essence, the other team, the them, and you can see it, the partisan difference being accentuated around the time of COVID. One interesting study was looking at trust in science during COVID and before, and concluding that the Trump effect, which is widely credited with promoting skepticism in science, according to this analysis, did not affect overall perceptions of science, but did increase polarization. So that is, again, my theme, that the polarization, for reasons I will describe, is really the driver here, and not so much the societal changes. This is in the context of overall declining trust in authorities, including governments. You can see a secular trend over a 60-year period coming down steadily, not just since COVID, being at the same low level for more than a decade now. And in line with the partisan aspect of this, trust in government, the blue line is Democrats, the red line is Republicans, and then you can see in small letters at top whether it's a Democratic or a Republican president. And guess what? When a member of your party is the president, you tend to trust government, or the electorate tends to trust government rather more than when it's a member of the other party. And we see the partisan divide reflecting in demographics and in particular education. Again, not too surprisingly, those with the most education post-baccalaureate have the most positive view of science. Of course, those are the people who probably studied science more and who are more likely to have faith in evidence and scholarly analysis and the elements of science. So my point here is that trust in science, trust in authority, has a lot to do with belief rather than thinking, rather than analysis, rather than conclusion. Belief, as in those lawn signs, is a badge. It's telling the world that you are on a specific team. And actually, the more you believe in the face of irrationality and contrary evidence, the more, the stronger that badge is. The more that you are saying, I'm not going to let things like facts get in the way. I'm sticking with my team. Sort of like a sports team in some ways. I don't care how bad the players are, they're going to win the championship. There's a shared sense of grievance, of powerlessness, of unfairness that you share with other people. And so you want to show your solidarity. You then show that you're part of a community, that you share this faith, and that you believe rather than think. And I think that's an important distinction. The New Yorker magazine had a story a few weeks ago looking at the nature of belief and arguing that when you believe something, it's different than when you think something. Thinking is generally based on evidence. Believing is closer to faith, which by definition is not based on evidence. What's the motivator for this? Again, it's the team mentality. It's us versus them. Don't like the elites. Corporations are in it to make money. Them. They're patronizing us. It's paternalism. Them. I'm in solidarity with the community of skeptics. The scientists are on the other team. And then often it's attempting to find easy answers. How am I going to eliminate the risk of COVID? Well, I'm going to drink bleach, or I'm going to take ivermectin. It's much easier than they want me to believe. Again, tied to feelings of powerlessness, of unfairness, of grievance. So back to my lawn signs, advertising your belief. I'm on one team, I'm on the other team. Cognitive science has a lot to say about how this works. We have heuristics and biases that guide the way we understand evidence. For instance, the availability heuristic. If an image or concept is available to us easily, like imagining a car crash, we will consider that a greater risk than if it's theoretical. The abstract fear of disease versus the actual perception of the consequences of the disease, or versus the inconvenience of wearing a mask or getting a vaccine or the other mitigation factors. Recency of what we saw most recently, i.e. COVID and the COVID measures, is going to determine our context. Confirmation bias, where we're likely to believe what confirms what we want to believe, and then the powerful notion of cognitive dissonance, that we want to keep our thoughts consistent, and when one piece of the picture is inconsistent, we discount that one. So if our leader, who we want to respect, says don't use a vaccine or don't wear a mask, evidence says use a mask, we can't have all 3 points of the triangle together in our minds. We have to discount one of them. And so for many people, it's discounting the one that says evidence says wear a mask. How do we rebuild trust? Don't deny false claims. We know that. We know that the more scientists discount the link between autism and the MMR vaccine, the more entrenched people come in their beliefs, because they're beliefs, they're not thoughts. And the more resistant they can be to empirical data, the stronger the sense of community, the stronger the badge of honor. Try to address the cognitive biases directly, what's motivating people, the images that they see, how recently they've seen them, how clear the risk is, and then speaking to underlying concerns. Is that easy? Absolutely not, which is, I think, why it hasn't happened. It's a lot easier to throw out more facts, but I don't think we're really going to address skepticism of science until we get to some of those underlying concerns, feelings of powerlessness, feelings of being taken advantage of. So my overall principle is faith and belief are much more powerful than simply empirically based thinking. The way to address skepticism of science is not to directly contradict the disinformation, but the need to accept disinformation. And to come back to my original quotes, understand the rationalization, not the rational, because at our core, we're all humans. Thanks.